Hello, everyone, and welcome to my podcast, Don't Get a Therapist Yet. And today I would like to welcome my guest. Her name is Caroline von Diest. She is a senior EMDR trainer, CBT therapist, and also uses techniques from IFS and ACT, which we'll be explaining throughout the program. So, a warm welcome to you, Caroline.
Thanks, Wendy. Hello.
It's a great pleasure to have you on today's program because you have so much to offer and you have so many skills. And I think we'll just start perhaps helping you to perhaps explain some of the things that you use. And you are actually an expert trainer in EMDR. So is it okay if we start with, how would you explain this term EMDR?
Yeah, no problem. Thank you for that. Okay, so EMDR, unhelpfully, stands for eye movement desensitization and reprocessing. It's a bit of a mouthful in itself, really. It's a psychotherapy. So therapists, existing mental health therapists who are accredited can come on a training and they can learn how to do this. And what it's looking to do is help people to heal from symptoms and emotional distress that are influenced from their nervous system, from their system, from the past. So it's probably easier if I give an example. Supposing we'll take something really simple, someone has a road traffic accident, and then after the road traffic accident, they notice they've got flashbacks and nightmares or worrying intrusive thoughts, or they're avoiding driving the car or something like that. What we're saying is that the accident itself, the memory of that, when it's playing through the mind, is not just a story that's in the past, but actually it's filed away with sounds, maybe symptoms, sensations, images. And so when the person thinks about the accident or they're in a similar situation, such as in a car, they connect to it. And rather than thinking, oh, that was in the past, I'm all right now, they're flooded with sensations, thoughts, feelings from this. So in EMDR, what we're looking to do, we don't have to work on every single thing from someone's past, but we're looking to say, right, okay, what is it that you need help with? And where does that come from? So we can work on the root of the problem to help them file something away. So it's a story that's in the past, may not be a nice story, but it's not influencing their mood, their mental health, their behaviors, thoughts, and feelings now.
Mm. And that's a really good explanation. And I think any listeners here can really understand what it's like to have a traumatic incident, whether it's a car accident or an accident at work or a traumatic experience they've been through as well. It can really feel in the here and now, and the actual symptoms are very distressing.
Yeah, most definitely. And when the therapists come on our trainings, one of the things that we're making clear to people is that when we use the word trauma, often we think of things like, major incidents of natural disasters, so hurricanes and massive flooding, or we think about house fires, or we think about sexual abuse, or we think about assaults, or those kind of things. But often trauma can be other situations. So we think of trauma in terms of adverse experiences. So things that have been unpleasant, that ideally they belong in the past. The story of them belongs in the past. But when you connect to it now, it feels like you're back there again, or it feels very, very real, very, very live. So a traumatic event can be any adverse experience that hasn't filed away and is causing you distress in the here and now. And lots of people can experience that on lots of different levels.
Absolutely, Caroline. That's so true as well. And I think sometimes what can happen is some people come with a diagnosis of PTSD or complex PTSD, but some people don't have a diagnosis of trauma. But then it doesn't mean to say they're not feeling the trauma themselves or they're not, experience the trauma in the here and now. What do you think about that?
Yeah, absolutely. When I was working in private practice in the UK, I used to work with a lot of rehab companies. So people would come along from, say, like I said, a car accident, but they didn't meet the PTSD criteria exactly, but they had the symptoms of trauma. So again, it was working around the other way. They've got some trauma, but they're not labeled with it. sometimes you get people who have been labeled with trauma and then they don't see that this is a trauma. Or sometimes people come along and they think, well, there must be something really deep and dark somewhere in my history that I've not uncovered yet. And they're frightened of thinking about life in terms of trauma. But if we think about how we're vulnerable when we're young and we need each other, we're creatures of connection, we need attachment. Sometimes the trauma is what's missing, not always just what's done to somebody. So really, trauma is about how you experience something and how you're still experiencing it, how it was at the time for you, but now when we're working, how you experience it now. So PTSD diagnosis could be present. It also could be missing, but there still could be a formulation, a way of understanding somebody's experiences now under that guise of trauma.
Mm. Yeah, very well explained, and that makes a lot of sense. It really does. And so, one of the benefits of EMDR is what you said. It's almost like the symptoms, rather be in the present moment, sort of go sort of get filed in the past, so they're actually not experiencing those symptoms. So, I suppose if they're having nightmares, would an example be they probably won't have any more nightmares, and then their sleep is better. Is that an
Yeah.
example of the benefit of EMDR?
Yeah. So, however, somebody's experiencing something. So, maybe somebody has nightmares or flashbacks. Maybe they don't. Maybe they have intrusive thoughts or they ruminate over something. Maybe they don't even have that, but they find in similar situations that their system is activated. So, their amygdala, their alarm system inside says, I don't like this. They might not even be able to make sense of why that is. But when that happens, then we're saying, okay, that's like the fight flight system. Your body wants to protect itself. So there might be something that we can connect to related to that from the past that's influencing them. So we do what we call processing. So that's the desensitization and reprocessing bit. So we help the client to process their memory. And then when they've done that, what happens is that people can still remember what happened to them, but they no longer recall it in the same way. So they don't have flashbacks and nightmares. They can't smell it anymore. They can't hear it anymore. They don't feel things in the same way. It's often a narrative that's in the past. You can think about it. Not always a nice story, but it's not causing you the same level of emotional distress. It feels like it's in the past. Whereas before the processing, it feels like, oh gosh, that's so close. I can feel it, I can hear it, I can smell it, I can see it, those kind of things.
Wow, it's a very powerful therapy, isn't it? And the way you describe it is immensely powerful. And I don't think a lot of people still know about EMDR, Caroline. Would that be fair to say? It's still not very well known.
I think it depends. Well, I suppose it depends on services that people come from and how they're set up. So the NICE guidelines, the National Institute of Clinical Excellence, has EMDR as a treatment, a potential treatment of choice for somebody, as you said, with a PTSD diagnosis, a post-traumatic stress disorder diagnosis. We use EMDR in lots of other ways as well. So if somebody hasn't got that PTSD diagnosis, they may not have heard of EMDR. But there's lots of research, randomized controlled trials for depression and other experiences that can be helped with EMDR. So I think it's certainly fairly new in that the first really tested we call it a randomized controlled trial. The first trial, which was really rigorously tested, goes back to the 80s, really. But it's been around for a long time. But again, sometimes it can be pushed to one side or you have to have PTSD. That's not necessarily the case. But some services are set up like that. So
Yeah, yeah, okay. Well, that's really good for people to know that it can help other problems as well, other than PTSD. Because that's really important. And I think sometimes what can happen is people can present with anxiety or depression, but maybe underlying that might be a traumatic experience that they haven't realized is, fundamental to linking their problems, their symptoms now of anxiety and depression. Is that?
absolutely. I mean, how many people go to the doctors having had an anxiety attack or a panic attack, And they could come out with a prescription. They don't often come out with an understanding of what anxiety is, why your heart is racing like that, why is your breathing like that. People can misinterpret, I think I'm going to die. And it feels horrible. It does feel like that at the time. And yet they're still here and they know that they didn't die. But then they become really, really phobic of those symptoms and those feelings, which in itself then becomes a trauma. So these are other ways that we can work with EMDR.
Very, very good. And can anybody have a benefit from EMDR? What about people with ADHD or autism? Do you work with people like that?
Yeah. So working with individuals, neurodivergent individuals is my want of a better word, special interest. So originally, before I became a psychological therapist, I worked in learning disability services. So then I worked with people with autism, and I've always had um, a, a, a leaning towards people who find it difficult to express themselves and make connections. I get such a buzz out of being able to make a connection with someone. I hate loneliness, and I think if we can be understood and we make a connection with someone, we really can help heal loneliness. So originally, my background involved working with people on the autistic spectrum. As time has gone by, when I moved across to adult mental health services, there were a lot of people who were not diagnosed with autism or ADHD, but then found to have some challenges with regular cognitive behavior therapy or something. And when I would meet with them, I'd think, oh, okay, I can see some traits or experiences here. So over the years, I've been known to be someone to work with this client group. And funnily enough, I'm ADHD myself, and my daughter is autistic. And one of the things that I love with working with EMDR for this client group is that we're not there to look at and challenge, are you right about something or are you wrong about something? Sometimes people find it really, really difficult to separate what another person's done and how they feel about themselves. And it can be really confusing. And when I work with EMDR, I find that people can work through a range of thoughts and feelings and experiences without having to use lots of words, without having to give lots of description. And so for some people who find it really difficult to have an abstract way of thinking, that they can process their memories really, really well. So I love working with clients who are neurodivergent with EMDR.
Mm.
Just the same with other therapies as well.
Mm. And that's brilliant because if somebody is neurodivergent, it can be another difficulty in engaging with therapy and actually finding somebody who's got the skills to enable that person. So that's great. You've got that real speciality. And am I right in thinking of the EMDR? Like you said before, it's not just about verbalizing, is sometimes you can have trauma in the body or you can have smells or what you hear as well. So I suppose what you're saying is with somebody who's got trauma, they don't always have to speak it out. Sometimes it's like a feeling in their body. Would that be
Yeah, yeah,
correct?
that's right. And for some people that they've gone through telling the story, they've used words, or a lot of the time we sort of say when we use EMDR, it's a bit like the penny dropping. So somebody can challenge things. Well, I know I'm not in danger now. That perpetrator is dead. I know that they can't touch me now. But when I go to that memory, oh my gosh, I feel like I'm back there. Or it's my birthday today, funnily enough. I'm 52. So I know I'm 52 now, but when I go to that trauma, actually, I feel like I'm 7 or 8 or something like that. So one of the things that EMDR really, really helps somebody do is they don't have to argue with that, but they can process it and they file it away. And it's like the penny drops. So it can be really, really helpful for that. They don't have to tell you every single thing that's happened to them. Lots of people have tried doing that. I do think there's a benefit in sharing experiences. And like I say, loads of great therapy with connection. We can make lots of change in lots of ways. But for some of us, sometimes we need to go at a deeper level than that. And that's where EMDR works really well. It doesn't just work on what you think, how you feel. For some people, that lots of people see images, the images become further away and the emotion is less intense. And they haven't got a reason for that they tangibly get hold of, but that's part of the processing. So I think it's a really great way of working without having to give lots of descriptions. So whether you're small and you haven't got a big verbal vocabulary, whether you're somebody who has got lots of words but it doesn't stick, there's the option for many.
That's really, really good. And I always think the name of it, EMDR, is a bit of a strange name, and people don't really understand what I know you've explained it. Could you tell us a little bit what to expect if you go to EMDR? So it sort of demystifies it a little bit.
Well, I can have a go. So yeah, it is a really strange term. EMDR, eye movement desensitization and reprocessing. So the first thing people think about is this eye movement. So what you'll find is that you'll be sat in front of a therapist when you're coming to process your memories, and they may ask you to track their fingers from left to right, either horizontally or diagonally. If you're working online, they may have some platform where you're looking at a screen and there's a ball going across. Some of us have got light bars, so the light goes across this bar and you can track it with your eyes. You keep your head still. And that's one way of what we call adaptive information processing. Is what you know about the world, and we use bilateral stimulation. So this tracking is what we do to help the trauma file away with what you know about the world. It looks sometimes like hypnosis because you're tracking a therapist's hand. It's got nothing to do with hypnosis. I'm not qualified in hypnosis. I don't do it and I don't teach it. But this idea of the bilateral stimulation helps the brain file something away. So I said emotions become less intense, less vivid. Images become blurry and filed away. They don't have the same charge to them. We can use other ways of doing that. So we also may have somebody tapping on themselves. They may tap on their arms, one and then or the other, or tap on their legs. Or maybe they might hold some buzzers that a therapist has at buzzers in one hand and then the other. All that bilateral stuff is really important because that's one of the things that's significantly different about EMDR, and we believe it helps you file things away. There's a number of theories why we think that's worked, and it's been researched to death, to be honest, because it all seems a bit weird. So whilst things are filing away, what's happening? We said the emotion and the intensity, how you experience it, how you remember something, files away. So it's in the past, it's not affecting you so much here now. So that's the reprocessing. So somebody who was assaulted, when they come to think about it, they can hear the attack, they can feel physically, they could feel like the pain in their, whatever, I don't know, their face or something like that. And then when they file the memory away, having used EMDR, they can tell you what happens, but they don't feel it. They don't hear it. They can't smell the things that they could smell before. They could tell you what they were, but they don't experience them again now. So it's using this dual attention, this bilateral weird finger wiggling movement, or another type of way of doing that. We're using that with what we know about memories and how the brain files things away to help a person take the trauma, file it away as a story, that's something that's in the past that's not affecting them now.
Okay, yeah, that's really well explained. And there's something about being in the present, and knowing you're in the present, and kind of knowing that you're processing something in the past. That sort of dual attention, so that you don't, like with hypnotherapy, you do actually kind of go into a trance and you kind of you lose consciousness, don't you, basically? But that's not the same with EMDR, isn't it? You're always aware
No.
that you're in
Yeah.
the room. Does that make sense?
Yeah, so we say you need to have a foot connected to the past and a foot in the present. We don't want somebody drifting off into the past in their memories and not feeling like they're in the room. They can't process when they're like that. The brain won't let them process when we're like that. You were saying, what can we expect? Well, the processing part of EMDR is really one part. We say it's an 8-phase treatment plan. So any client of mine or any of my participants on the training, the first thing that we have to do is understand what someone's come for. What is it they want help with? And then we're looking at, right, where did this problem come from? Because we want to deal with the roots of the problem. You know, the brain is wired for healing, just as the rest of your body. If you cut your hand, you know that your hand will heal and you'll recover from that. Well, the brain can do that as well. What we don't want to do is put a sticking plaster on the top. We want to actually get to the root of the problem. We don't want to leave an infection in there. So we want to get the person, we want to work out, right, okay, what's your problem now? Well, I'm scared of going out at night. Okay, where did that come from? Let's have a look. So the very first part of treatment is understanding, joining the dots, like we said, the past that affects the present, and then where do you want to go with this, the future? What are your goals? Then the next phase of treatment really is about making sure that someone can cope with working on their trauma memories and they can cope with in between sessions. Told you I'm ADHD, as you can gather, I can waffle for England, but so I can help distract somebody, but they're not going to want to take me home with them everywhere. So they need to have some strategies to be able to do this for themselves. So we're not looking at people feeling super calm and like, they've had a day at the spa, but just that they can manage and function. In the room, when you're in the room with the therapist can help with that. Outside the room, what do we need to make sure is around so the person can cope with that? The next part of the treatment, so the phases 3 through to 7, are all about activating memories and processing them. And then the last phase is about evaluation. So it says, let's work out the memory that we're working on. How's that doing? Have we filed that away? Okay. Then let's come back to our treatment plan. Have we done everything that we need to do to help you with the now? So maybe you've processed something like the road traffic accident, process that. That's a memory. It's now a story. Not a nice story, but it's filed away. But there's still a bit of anxiety when you go around roundabouts. Okay, well, we can work on that next. Oh, and let me just look at the goals. I want to be able to travel across to France and drive in another country. I'm a bit nervous about doing that. Not done it yet, but I'm thinking of it. Okay, so we can check in with those things. So EMDR is not just memory processing. It's a whole way of looking at how somebody makes sense of something, putting together a treatment plan and processing and reevaluating. So the therapist will work with the client, they'll be listening to the client, collaborating with them about what are their goals for therapy. Maybe they'll be teaching them about anxiety, like we said earlier on, or, this is how I see that the dots are joined up here. This is how this links to this. What do you think about that? Can we work on that? What do we need to do that? And as therapists, once we start processing memories, we don't just sit there waving our hand in front of someone's face. If a person is able to process, we say, it's like you're sitting on a train and the scenery are your thoughts and your feelings going by. And my job as a therapist is to help that train keep running. If it gets stuck or it goes into a tunnel, I might be more active in what I do and how I do it. And otherwise, I'm going to keep just making sure that it's going the way that it needs to do. So we're really working together, but it is the client's brain that does the healing. It's the client that goes away with the changes there. I can't do something to somebody's brain. It's all there for them. I'm just helping them work through it.
The way you describe it, Caroline, it does sound an amazing therapy and so thorough. And the actual thoughts of, these actual painful memories going, these sort of experiences going, I think it's the most powerful therapy around, personally. And so I'm very pleased to have you on the show so that you can sort of really explain it. Being a trainer, you can really explain it, and you're explaining it exceedingly well. Now, at the beginning, we did talk a little bit about a couple of other sort of techniques you integrate into EMDR, isn't it? And we use the words IFS. Could you perhaps explain a little bit more about what that is and maybe an example of how you might use that alongside EMDR?
Okay, so the first thing I should say is I'm not IFS trained. So I told you I'm ADHD. So I'm one of those nerdy people that when she's cooking her dinner, she's got an audio book on somewhere. And then I've signed up for like 12 webinars, of which I've probably only watched 3, and on 1.5 speed as well, that kind of stuff. So I would never call myself an IFS therapist. But what I like about IFS, it stands for Internal Family Systems, originally developed by Richard Schwartz. And I would recommend trauma therapists to consider this along with other ways of working. But sometimes when people are working or they're on their trauma or what they've experienced, they can get really stuck and they can find that They want things to move. They desperately want things to move. However, they don't know why, but it's really hard to do so. So it might be that um, we talk in terms of the word part. So supposing I'm working with somebody who is taking the blame for everything that ever happened to them when they were little, and they know they were little, they logically know that, and they're processing really, really well through their memories. So there's working on a number of memories that filed away, and when they think about them now, there's no distress. It's not a nice memory, but it's filed away because there's no distress. But they keep on with this idea of I'm not good enough and I'm not lovable. And one of the things I might do if I was including something like this is say to them, well, there's a part of you that really, really beats yourself up here. And that part does that because it wants to protect you. It's almost like, you know, I told you I'm 52. So when I grew up, we had Tom and Jerry, and you'd have that little devil and angel sitting on your shoulder, and it's kind of like something sitting there going, "Oh, you don't want people to know about this. Don't speak too quickly. Don't be seen outside. Don't do this." So this part that really beats them up, and it doesn't mean to be mean. It's trying to protect you. I don't want you to show yourself because somebody might hurt you. But of course, the way that it's doing it is really quite damaging for a person, and it restricts them in their life and it makes them miserable. So sometimes by being able to help someone understand the experiences, their internal experiences in that way, they can connect with that and they can look at, right, what is it that's blocking me here? Or what does this part want from me? So then I can work out what we're frightened of, or maybe we can process that with EMDR. There is some IFS and EMDR training. It's not me that does it. There's lovely, I'm pretty sure the lady's name is Annabelle McGoldrick. I'm pretty sure I got that right. But you could Google IFS and EMDR, and there's lots of really good, I hear lots of really good things about that training. That's one way of working. I said before I'm a CBT therapist, and there's you mentioned acceptance and commitment therapy, ACT. And again, that's another way of helping somebody to look at how they see themselves, how are they living life? Is someone living life by their goals? You know, oh, I want to be the CEO of whatever. Okay, well, when you get there, what do you do then? Or are you someone that wants to live by your values? Well, I want to be the CEO of whatever business, but I want to be someone who is kind and caring and empowering and is inclusive and protects the climate, that kind of stuff. So there's lots of different ways of looking at how we do things, why we do things, how do we challenge unhelpful ways of thinking. And some of these things can be built into the EMDR therapy in that preparation phase for saying, right, okay, let's just learn about our thoughts a bit. And how can we prevent relapse? How can we use these things to be helpful and guide us moving forward? So EMDR is a really adaptive therapy. It can work alongside with and in conjunction with other types of therapies as well.
Mm. And you know, you described two other therapies, which are both excellent therapies, and have their own kind of theory, research, and in depth as well. And congratulations on the skill that you've just shown, Caroline, is that ability to integrate them as well. And it's nice to know that somebody can come to you, you know, either to receive your training or to if you still take people on or your organization does and actually have the knowledge and you know the security to know that they're actually seeing somebody who's that sort of experienced and that competent, because I think when you've got when you're vulnerable and you do have trauma in your life, you often feel very sort of, you know, worried about talking about it or processing it or you know, or even coming to therapy in the first place. Sometimes the first step can be huge for some individuals.
Absolutely. It's really vulnerable, isn't it? You're coming along with the things that you're worried about, the things that have happened to you. You're going to talk to a complete stranger to start with. You know, you don't really know a great deal about that individual themselves. You can find out a bit of information maybe, but still. But one of the things that in MindSync, that's our training company, I work with this brilliant trainer, Hannah Bryan, is that we want people to realize that they're not coming out to be little robots. We're not making EMDR robots. I don't think you can have that in any therapy. You're people. And lots of therapies have got lots of great great ways of working. What we want people to do is we want them to understand what EMDR is, how we believe it works, and we want them to understand how do you find out about the client? How do you connect with the client to build a treatment plan that's best for your client? And that's really, really important. So you and I, Wendy, we could read the same book, we could go on the same training, but there'll be something different in our delivery because we're individuals. And so it's really important that we acknowledge and respect that, but also that we adhere to the fidelity of the model because we don't want to go rogue and go, well, we'll just do what we like here. Well, I don't know, I'll make it up. That wouldn't be helpful either. So in the beginning, when people learn about EMDR, they very much are told, you do it this way, you say this, we want to introduce you to the very beginning. And I always say to people, if you were commissioned to make a cake for the royal family and you've never baked before, you're not going to start with that great big, wedding cake as a beginning. You've got to learn how to bake a flaming fairy cake first. And once you've got your baking skills in play, then you can start decorating and you can start tweaking and start dealing with some more complex and difficult things. And EMDR training should be like that. You come to a basic accredited. There's lots of companies out there who are offering EMDR training who are not accredited with the EMDR Association, and that means that there's no gatekeeping for them. I couldn't tell you anything about where these people come from, what their training involves, how or why they teach something. We're monitored and we're ratified. We adhere to regular guidelines and continuing professional development, just as other accredited individuals, in order to be able to say that we provide quality and research training. So we invite people to come along to the training if they meet the criteria. And then we're saying, right, okay, we'll teach you the basics. You practice, you have to get involved in the practicals in the training and in between the trainings. And then as you go through, you learn more advanced skills. But when you've got the basic training out the way, then just like, everything else, so when you drive a car, then you really learn, okay, how do I build on that? And how do I then flex it? So there's lots of opportunities and lots of ways of doing it, but it is a process to go through.
Absolutely. And I think what is, reassuring to somebody who is considering, who feels that perhaps a listener who feels as though they've tried other therapists that haven't really worked, but they feel this sort of like, deep anxiety in their stomach, or they feel they know they've got childhood memories. It's really reassuring to know they're going to somebody who is properly qualified, who's accredited and very safe, because it's very, very big thing, isn't it, to open up to a therapist and to sort of share all those vulnerabilities. You want to know that that person is going to hold you and know what they're doing when you actually start, imagining these traumas. It's a big thing, isn't it, to suddenly sit with somebody and actually go through these traumas and to feel safe and feel that you can trust the therapist enough to actually,
Yeah.
hold them, as we would say, not actually hold them, but to make them feel supported when they.
Absolutely. And like we said, so my job as an EMDR therapist is to help make sure that that processing can occur. So I don't just plonk my client in front of a ball and, go off and make a cup of tea and go and do my shopping and come back an hour later. That would be completely ridiculous. And they wouldn't need to come to me if they could do that, would they? But also, I'm there to offer them that stability and the security that when you go to those places that are really scary, you're not on your own there. I'm here to help you work through this. I'm here to tweak what we're doing in order to make it possible so that we can do it safely.
Yeah, very good. And I also think sometimes when people start EMDR therapy, they've read around, they've looked a bit on sort of YouTube and everything like that, and they've heard it's good, but they don't quite believe it. They're quite sort of like, this can't really work, yeah, it won't work for me. And then often when they actually have that experience of it working, there's quite we would say an aha moment. It's like, wow, my goodness me, this is gone. Where's it
Yeah.
gone? You know?
Yeah. I've known clients like that. And there's, what have you done to my brain? What have you just done? And you've explained therapy, but still. And I've known therapists that come on our training, and I'd have to confess to be one of them. When I did my original master's degree, we were introduced the idea of EMDR, and I thought, oh, this is hocus pocus. You've got to be joking. And it's not a very glamorous story, but I was in the ladies' loo, earwigging the conversation as somebody was washing their hands. And she said, I got BDD, body dysmorphic disorder. She named another therapy. I won't name that. She said, well, such and such is rubbish. And EMDR is awesome. And there happened to be a talk on EMDR at that time. So I thought, okay, I wasn't going to go, but maybe I'll go and listen to it. And now, all these years later, here I am, an EMDR trainer. So that lady in that conversation really changed my world. But in the beginning, I thought, this is just nuts.
It's amazing
Now,
learning the
yeah,
toilets, isn't it?
yeah. Now it's amazing. And like you say, I have the privilege of watching people heal and sometimes saying, I don't know how we could have done this through talking therapy, because it's not just the talking and the language, it's how somebody can feel differently, how they no longer feel that punch, how they no longer smell that smell. I don't know how I would have achieved that without EMDR. And that's something that's really amazing.
Mm, absolutely. And again, I'm just wondering if there's some sort of listeners who are considering it. What do you think about EMDR online? Because traditionally therapy used to be all face to face until COVID, and now we've created this sort of online system. What do you think about that, Caroline?
Yeah, so I use therapy online. I work on a platform like Zoom, or I use another EMDR related platform. Um, I was kind of in the beginning, I had very little choice about doing that because uh, for my sins, having said I'd never date another person on the planet, I came to a Europe EMDR conference, went home with a certificate and a Dutch husband, not all in the same weekend. But when we decided where we were going to live, because life's too short to keep going back and forward from various countries, my daughter and I moved to the Netherlands, and my Dutch is not good enough to do therapy. So I had no choice but to do therapy online. So my therapy online happened way before COVID. And I got good results with people. I worried that I wouldn't, because I always wanted to, I like the connection, I said, and I do like training in person. I do like working in person in the same room. But if done well, therapy works well online. EMDR works well online, and there's been some research since COVID. One of the joys are that, of course, everything gets questioned in research. So they've looked at whether you can work with people online effectively, and the research indicates that is the case. Us clinicians know that, but we've got some backup there as well. So you don't necessarily lose things. I still like to be in a room with a person if I can. That would be my preference, but it can work really, really well online as well. I would want to make sure, though, that I've got some safety nets, like I've got contact numbers, or if I'm working with someone with really complex needs, I want to make sure that there's other people that are around. If my client becomes really distressed and runs out the room, I can't run after them. So I want to make sure I've got people around or ways of contacting for help. I want to make sure that, we've got a good internet connection, for argument's sake, because if you hear every other word, that could be pretty distressing in itself. So there are things that you have to think about. There are things in-person treatment that you have to think about as well. So it's just about being adaptable, really. And of course, you still get the person, so you still have to build up those relationships.
Mm. And the other thing I think which is really good about online therapy is that you can choose your therapist as well. So there might be somebody who in their area, they might live in a, Scottish village miles away from anything where there aren't any, it doesn't stop you from accessing EMDR, does it? It actually opens up a whole new network. Like you say, you could be in the Netherlands and still provide EMDR over here. And
Yeah,
that's great, isn't it? That's
yeah,
amazing. You can do that. Uh,
yeah.
it
Lots
opens
of
up
opportunities.
opportunities. Yeah, that's good. And I think you're also saying that perhaps somebody's tried therapy before and maybe they've got anxiety or even OCD, maybe, or depression. There's certain conditions where they think, maybe I haven't it didn't quite work for me, say CBT. I'm not saying that CBT is wrong, it just hasn't quite sort of touched everything. Would you encourage them to actually consider EMDR?
Yeah, I mean, I would encourage someone to go along for therapy, and if the person does EMDR, then definitely be open to it, because how you do EMDR, like we say, that the how soon you work on memories can vary from one person to another. So they might need extra support in order to do that. They might not because of other therapies that they've done before, so they don't need so much. EMDR obviously can help a range of experiences and needs. So I would if I was meeting someone for the first time and they didn't even know about EMDR, I might well tell them about it because I want to work out, right, what is it that you're here for? What do you need? And what tools have I got in my toolbox that can be helpful? So that's not just trauma as in PTSD, it could be a number of different things. If someone's had EMDR or said they've had EMDR before, sometimes people have found it really, really difficult to do those preparation things and maybe not been able to continue with the therapy, or maybe they've worked with someone that's not been so experienced. So even if they've had it before, I'd always encourage them to talk to the therapist, because it may be that they weren't ready, or the therapist wasn't, experienced enough, or whatever reason. Maybe sometimes services don't even allow somebody to have that many sessions. So it might be that you need to come back to the drawing board and think with an open mind in those ways. And like we said earlier, EMDR can complement loads of other ways of working as well.
Absolutely. And in my experience, what can happen is a person sort of starts with EMDR and they're not quite sure, and they haven't sort of quite got it. But as soon as the penny drops, as you said, and they have that aha moment, they kind of like it's a natural flow as well. They sort of say, "Ah, this is how it works. Ah, right, I understand it," and they're able to sort of much better tune themselves to they know what they're doing now, and so it actually becomes a lot easier most of the times, and they know that they can cope with it as well. They know that they've got enough techniques to, like you say, to cope with it outside the sessions and everything like that. Is that your experience as well, Caroline?
Yeah, and sometimes we encourage therapists to work with somebody on, say, a trial memory. So something like they would bring along to the training, because all the therapists have to sit in that client chair when they come to our EMDR trainings. So sometimes we say, right, well, we could do some EMDR on something really low level. It may not really affect your whole entire world, but it will give you a flavor of what EMDR is like. So sometimes people will do things like that, rather than jumping into the hottest and the most distressing experiences. Sometimes it's not possible to do that, but the therapist needs to evaluate that with the client and see.
Mm. Okay, that's absolutely fine. Um, and just curious to know if somebody is feeling any kind of negative feelings, like some sort of embarrassment or shame about their trauma, that they don't want to disclose. I think you just touched on it earlier, but I just wondered whether you could say how would handle that. Uh,
Yeah, so I might talk to people, like we said earlier on, about there's a part of you that's really feeling bad about this and frightened to talk about things. We might, or to go there. So we might look at how that's being experienced and what's keeping that going for somebody. We said that you don't have to tell us exactly point by point what happened. So that can be helpful in that clients don't have to worry about disclosing acute details, real precise details of an event. So I've worked with clients where I've known that they've been assaulted, but they've not had to say, and this happened, and this happened, and this happened in such detail. Um, Whenever I'm working with things like shame, I really need to, again, get to the root of that. Where have they learned that? What's that about? What's keeping that going? So sometimes we can process that shame. We can process the fears of letting go of something. Sometimes people beat themselves up because they're really terrified that deep down they could be an awful person. And what if they were to let that loose? So we might work in those ways as well. So shame is something that can get in the way of therapy, understandably. Our job is to help a client recognize when it's there, and then we're helping the client to heal from that shame so that they don't have to carry that around.
That's a really good explanation, and hopefully people hear that. And if they feel too ashamed and that's getting in the way of them accessing therapy, they know that they will be supported through that process, and
Yeah.
actually even lose a feeling of the shame. I mean, that's really good to hear. So Caroline, thank you so much. I mean, it's such a fascinating therapy and subject, and thank you because you are an accredited trainer. You've got that, massive in-depth knowledge of EMDR. So I hope people have really benefited from listening to you today. Can you tell us a little bit more about how to get in touch with you, either from a therapy point of view or for a training point of view?
Yeah.
How would a person do that?
Okay. So the training company that I set up, funnily enough, this week actually is the first 1 year anniversary from when we first ran our very first independent training in Stafford. So the timing of this is really quite poignant. We run small group trainings, so we don't have more than 24 people on our training in one time, so that there's plenty of time to relate to the material, to ask questions, to think about the clients that individuals are working with, and to work, in depth. So our training company, we have a website called MindSync, emdrtraining.com. So mind, M-I-N-D, sync, S-Y-N-C, emdrtraining.com. It's all one word, that MindSync EMDR training. So you can contact us through there. So the training schedules are on there, the eligibility criteria, because people do, we require people to have been experienced with mental health training previously. They need to be accredited in certain ways. So the eligibility criteria, which is set by EMDR Europe, is on there. And if people are interested, you can see on there how to join up, where our trainings are. We do run some online trainings. We run in-person trainings as well, all across the country in different places, and we will be expanding that later on. There's contact details on there. So we have a Gmail that you can email us on there. I can provide you with my email address for therapy inquiries. Um, I'll provide it to you because otherwise it'll get confusing. Um, and again, you could Google my name and you'll see Synthesa Therapy is my therapy arm of my company. So you can always find that there, and there's a contact number there. A lot of the people I work with, as you mentioned earlier, neurodivergent, or there's therapists that are looking for somebody who knows how to work with autism and ADHD particularly. And you can find me there.
That's fantastic. And like you say, just actually knowing that speciality, that's a very rare skill, I think, to do both EMDR and neurodiversity together. So I hope people who have got those problems contact you and find out a little bit more about how amazing EMDR and how effective it is as a therapy. So thank you so much, Caroline.
Thank you. There is a really great collection of EMDR therapists. I run a special interest group through the EMDR Association, and there are some really brilliant therapists out there. They're just not necessarily known about, or, our networking ability perhaps has not been so good because we're all so busy. So there are some really great therapists, and the same with CBT. There's some really great therapists working with neurodivergent individuals. So yeah, I encourage people to look around because there are people who do get it, who are understanding and who are looking to understand a person with that lens on. So it's really valuable.
Absolutely. Yeah. And thank you for that. Yeah, that's really, really useful. So thank you so much, Caroline, for your wise words. And I hope you get inquiries from here because I cannot say enough about EMDR as being such an amazing, powerful therapy, and you being a specialist in training it is amazing. So thank you so much, Caroline, and thank you everyone for listening.
Thank you so much. It's really great to be here.